Wow, you've been busy.
Yes, busy.
You've done quite a bit. How do you balance all this, advocating for all these different families while having your child and being that she's 3 years old, over those 3 years, and now she's going to be growing into a very active toddler as well.
Welcome to Posture and Purpose, where both healing and community come together. Make sure to subscribe on Apple, Spotify, and YouTube. Let's get into this episode with Dr. Michelle Carr-Frank.
Hello, and on today's episode of Posture and Purpose, I have Miss Victoria Garcia, who is a registered nurse, but also the founder of Julia's Advocacy. She's here to tell us a little bit about what that is and how she's doing to shape a certain community. So welcome, Victoria.
Hi.
Thank you so much for being here. To begin, can you tell us a little bit about not only yourself as a registered nurse, but also your role as an advocate?
Yes, well, I'm so honored to be here today. I'm so excited. I love that we're both wearing green because green is our community achondroplasia awareness.
Yes, I looked it up. So.
Yes, it looked fabulous.
Thank you.
Yes, I am a mother to a daughter, Julia, who's 3, living and thriving with achondroplasia. I've been a registered nurse for 13 years, going on 14 years, with a background in maternal postpartum care, neonatal care, and pediatrics. And with that, I kind of saw my career come full circle when my daughter Julia was born with achondroplasia. Yeah. And over the last 3 years, we focused on starting Julia's Advocacy, which is a platform for parents who have children with achondroplasia or have achondroplasia themselves. And they can reach out to our platform for resources and connect with other families. So it's really become global, and it's been exciting these last 2 years. And we've helped a lot of families, and they've helped me as well. So.
What a wonderful reason behind your cause. But I can tell you, most of our listeners do not know what achondroplasia is. I'm very familiar with it because of my training with chiropractic. But can you explain what exactly achondroplasia is in a simple and compassionate way?
Yes. Achondroplasia is the most common form of dwarfism. So even when we say it's the most common form, it's still incredibly rare. So 1 in 28,000 births is the newest estimate for the prevalence of achondroplasia. 80% of babies born with achondroplasia are born to 2 average height parents. So anybody is able to have a baby with achondroplasia.
Yes, people don't know that.
Yes, it's not a gene that either one of us carry. The remaining 20% of babies born with achondroplasia are born to a parent or either both parents who have achondroplasia. Okay. So my husband and myself don't have any family history of achon, but it's a single genetic mutation blip. It's just a little flip from G to A on the gene. So
yeah, specifically, is it FGFR3?
Yes, that's the gene, the FGFR3 gene. And so it's really, really rare occurrence, and we feel really blessed to have Julia with achondroplasia, and there are 721 different types of skeletal dysplasia. Half of those can have fatality, but the other remaining half have, certain complications that we monitor for, but Julia's doing really well.
And like I said before, what a wonderful cause. And she's lucky to have you, that's for sure. And you mentioned that 80% of the cases would be considered spontaneous.
Right.
Is that correct?
Yes, they happen at conception. So there's no way to really predict whether a family will have a baby with achondroplasia. I think the latest that I read was somewhere in the range of 1% of a chance of around 1% of a baby being born that way with achondroplasia.
So rare. Can you share with us the moment you first learned about Julia's diagnosis? How did you feel at that moment? I mean, with your background in the medical field and just that feeling, would you be able to share that with us?
Yes. When I first found out that something was not measuring within normal limits on the ultrasound was at 32 weeks. So I went in for a routine 32-week ultrasound. On the scan, they found that all of her long bones were behind 1%. So it was really shocking and honestly very terrifying. I was terrified because you can't really determine on scan right away whether that is a fatal form of dysplasia or if it's something more moderate like achondroplasia. And so it started a lot of uncertainty. We were in shock. We also had to wait 4 weeks with an amniocentesis to determine what the genetics were.
4 weeks?
4 weeks. And so we didn't find out for sure of the diagnosis of achondroplasia until I was 36 weeks. And then I had her at 37 and 1. So it wasn't much time to process.
Not a lot of mental preparation. And how did your emotions take place? I mean, it had to have been, like you used the word shocking, but how have they evolved over time?
Right. So I was devastated at first because they were telling you all of the possible complications, which there are a wide range. It's kind of a spectrum. They were preparing me for worst case scenario, and that's a scary place to be when you're pregnant and hormonal, and baby's not in front of you. So I had to lean a lot on the community and reach out to parents. But the hard part about that was I was doing that kind of on my own on the back end through social medias. There wasn't really...
Really? There's social media?
Yeah, there wasn't really a platform that I could go to and say, hey, I need to speak to another mom. It was mainly through social media. So they were amazing and really helped me. And seeing other children thriving and doing well was giving me a lot of hope. Sure. But the wait for the 4 weeks of the diagnosis, that was really almost unbearable.
I can't imagine.
When they were measuring her on scan, her lungs were hypoplastic, and they thought she would have hypoplastic lungs, and chest was really small, weren't sure if she'd be trached. I mean, there's so many endless possibilities of complications. So we were pretty terrified. And to say how those have evolved over time is just seeing her, once she got here and you hold your baby and they're doing well, even the ones that have some complications, achondroplasia has so much hope for their future. And so that's really evolved into, she's taught me, I think, more than I've even learned through the achondroplasia. So yes, I really feel empowered with her now. I'm very proud of her. And we have an average height son, Grant, who's 9, who just loves her. And they're so fun to watch them together. So yeah, she's really a joy and a pride of mine now. So
I love to hear that. How old is she now? You said 3?
She's 3.5.
Okay. And how did you mentioned your son, how did you all prepare as a family?
Yes. So once we were we didn't say anything until we were for sure. I had to wrap my mind around what was happening. And also, just to backtrack a little bit, this was the field I was working in at the time. So I was a postpartum nurse. And so your autonomy is a little bit stripped from you when your colleagues and best friends are the ones that are pretty much diagnosing you. It was a very surreal experience. So I'm walking into rooms that you're supposed to be the patient, but you still kind of feel like you're on the floor. And it was just a weird experience, honestly. And it was very jolting. So we got that under control when we knew for sure she had achondroplasia. We just waited till baby was here. We let my son bond really well with her. We explained to family and friends that her bones would grow a little differently, and pretty much that we were going to be monitoring the things to monitor for. Right. But everybody loves her, and she did so well that was another thing. I like to tell parents that the birthing process was very scary because there's a lot of unknowns, and a lot of physicians aren't that aware of the protocols for achondroplasia. But Julia was born normal vaginal delivery, no epidural, no pain medication. Oh. And the reason I say that is because it's just to give a little insight of my frame of mind. Because for Grant, I had an epidural. It dropped my blood pressure. His heart rate dropped. Then he aspirated at birth and spent 3 days in the NICU. So then for Julia, they were so worried about that bell-shaped belly in the chest that I really put myself in this state of mind that I didn't want to do anything else to harm her. And I just had that baby and it was fine. And so I just tell people that to encourage them a little bit, that honestly her delivery was even better than Grant's. So it can have really positive outcomes for delivery as well.
And that's promising for people to hear.
Yes.
So I imagine your medical background as an RN, I'm sure that shaped part of this journey. You mentioned feeling like you were supposed to still be on that floor, but since you've processed this in the last 3 years, how has that journey changed?
So I think I've really taken everything I've learned through the diagnostic process and all of my nursing background. And one way for me to cope is to just channel that into advocacy. So we've connected with, I think, 2,500 families globally that are either have achondroplasia themselves and living with achondroplasia or have children that have achondroplasia. So it's really been a cool experience. And it really helps me whenever, because I was in a process of a postpartum crisis with all that happening because this is a risk factor. Yeah. And so helping to empower another mom kind of gives back to the autonomy that I felt was stripped. Right. So it just, to see it come full circle and to be on the other side of it, it's really amazing and experience.
That was a blessing.
Yes.
For the other family as well. So how have you seen like a strong co-management care among other healthcare providers? Or have you not seen a strong co-management of care? How are doctors trained? How are pediatricians specifically in this area trained to be ready for a patient?
So we were really, really blessed because right when Julia was being born, there was a committee of, I think, 14 experts globally that got together and they wrote the International Consensus Statement for Achondroplasia. And I recommend that resource along with the AAP guidelines for achondroplasia that have been recently updated to every new parent and every physician that's taking on a patient. Because I do get a lot of physicians that reach out through Julia's Advocacy. And it really breaks down all of the protocols. They all got together and voted and discussed what is the best time frames, when do they need an MRI, who do they need to see, what kind of specialist. And it takes all the guesswork out of a physician just reading through if that's their first patient. So that's an amazing resource.
Sure.
And that's really that's been a game changer for it. And Julia has, I think, 8 or 9 specialists. So they need to see a neurologist within the first 3 to 4 months to monitor for foramen magnum compression. And that is one of the most common causes of a SIDS event in a baby with achondroplasia. So you want to make sure their foramen magnum is okay. They see orthopedics to monitor their bones, their spine. And let me backtrack too. For achondroplasia, it affects mainly the long bones. So it affects the way the cartilage turns over into bone at their growth plate. So we're monitoring bowing in their long bones, their spine, and the rib cage. They see an ENT because these bones, the ethmoids of their sinuses and the perpendicular plate of their nose is smaller. So they have apnea,
yes, I saw that
complications. And for their ears, because they're more at risk for ear infections, we see our pediatrician, we see a physical therapist, because the FGFR3 gene is expressed in the musculature as well in ways that were not fully understood yet. So they are hypotonic, which is like floppy baby. So we have to watch that musculature system as well.
Yes,
So many different, a lot of monitoring in the first year of life.
So this keeps you very busy.
Yes.
Are you still practicing as an RN, like in the hospital?
I do more independent nurse consulting now for the community, but I've stepped away from bedside. I had to for the first year or two to focus on Julia's care.
Well, of course, yes. That comes first and foremost. Okay, so you mentioned the foramen magnum. Most of our listeners are not going to know what that is. So the foramen magnum is where the skull or the brain stem intersects with the spinal column.
Exactly.
So that area can become, I don't want to use the word pinched, but stenosed.
It is almost, stenosis, a pinching. It's right at the base of the skull.
Yeah, so just so you guys listening, that can be very concerning for a parent or a patient and a medical team trying to work around that.
Yes.
Okay, so, with that being said, has Julia been diagnosed with any spinal stenosis? How often does she have MRIs done?
So we had one baseline MRI when she was 4 months old, and that showed that her foramen magnum was clear, so she didn't have compression.
That's a blessing, yes.
We do have many, many parents that do go through foramen magnum decompression surgery, and the infants do very well with it. So I know it's like a scary thing to hear. They have great physicians. If you need resources for that, reach out to us because I have great families I can connect patients with. But yeah, so her foramen magnum was fine. She didn't have, sometimes when you do have foramen magnum compression, it can cause a secondary hydrocephalus because it's causing a back pressure into those ventricles. So we didn't see any of that. Sometimes they'll need a shunt, but Julia didn't need any of that. Good. We've had 0 surgeries. We've been extremely blessed. We haven't even had tonsils, adenoids. She's never had an ear infection, really. I mean, we've been very, very blessed. She's been extremely healthy.
Yes.
Sometimes they do need other things with spinal, or if they're having respiratory issues, sometimes they'll need tracheing, but we've never needed anything. So we've been very blessed.
Yes, it sounds like it. So what are some of the biggest misconceptions? We could probably talk about misconceptions with this all day long. But if you had to pick a few, what is the biggest misconception or one of them that you would love to correct today?
Yes. So one of the biggest misconceptions is that their quality of life will be poor. You may have complications related to achondroplasia, but most of them are manageable. Also, that intelligence is affected. So generally with achondroplasia, cognitive function is intact. There's not really an association with intelligence. So they live full lives. I know many that are doctors, lawyers, all kinds of dental hygienists, so many cool things, teachers, secretaries. So yeah, they live full lives. They go on to have their own families. They can do everything anybody else can do. They just may need a little adaptation for it. So
sure, exactly. And what does the day-to-day life look like for her? Both the challenges day to day, or maybe the joys that you guys experience?
Right. So for Julia, she's full of energy. I tell everybody, I honestly forget she has achondroplasia, and all kidding aside, like, she's my easiest child, even with achondroplasia complications put aside. She's strong, she's active, she's so smart. She talks all day long. I have no idea where she gets that from.
I wonder.
Yeah.
I wonder.
She's communicates about everything. She plays. She's just such a light in our lives. She's very easy. She's always been a great sleeper and everything. So day-to-day life. The only thing with her is just from a musculature system. Sometimes she's more lax, so you just have to be careful running. There's a lot of tripping, that kind of thing. So, but we use shoes that are high top to kind of keep her ankles in alignment. And that's about the extent for us with that.
It kind of stabilizes things.
Yeah.
So, and being that you started this, I can't imagine you have a little one at home, you have a child with achondroplasia, and then you start this very successful advocacy program. How did that vision take shape? I know it started with Julia, but how has it progressed since then?
I will say that this all started specifically because I was reading on our forums parents going through the diagnostic process and being told a lot of misinformation or unclear information, and it really set me up for a very hard postpartum journey, and I just couldn't bear to watch parents experience that. And so we laugh in the community. I'm kind of known in the community lovingly now as Nurse Vic, and I don't know how, that's just how they get me. They're like, "Hey, Nurse Vic." I'm like, "Hey." I know they're from the community if they call me that. So we call this the Achon Encyclopedia. It's full of all the latest research. I bring it to all of my doctor's appointments, and anytime a parent reaches out to us, we have all of this in PDF formats that I can send them any part of the literature that they need. So yeah, I keep this thing updated, and we connect with the community in that way. And I travel independently. My husband and I do that to all of the skeletal dysplasia conferences in the United States. So there's 2 main ones right now that I go to every year, and make sure I keep all the latest information, make a lot of connections that way.
And you bring that all back to the families in Louisiana?
Yes.
Okay, so before you did this, there was no one in this area that did so?
In the Louisiana area?
Yeah.
Not really. I mean, we had some social media groups that would get together and, meet up or that kind of thing. But we have 2 other advocacies. They are nonprofits that are doing really well with disseminating information, and then the LPA Association as well is a huge platform. But as for bringing all the things like treatment related protocols, where to find physician in what areas, I even have like resources for that. Not really. I'm trying to get that together so we can disseminate information like that.
Wow, you've been busy.
Yes, busy.
Quite a bit. How do you balance all this, advocating for all these different families while having your child, and being that she's 3 years old, over those 3 years, and now she's going to be growing into a very active toddler as well? How does that affect her and her independence and her growth?
Yeah, so I'm really blessed to be able to do this Monday through Friday, 8 to 12 in my office. I have a little just advocacy office. I connect with parents there if they need. I'm really blessed to be able to do it from home. And yeah, it leaves a lot of time for me to be with the kids in their afternoon programs or whatever they got going on, because my son as well, the sports fanatic, so we're always in something.
Mr. Grant,
yes.
I got to see him the other day. So.
Yes, and Julia's into all kinds of things too, art-wise, and wants to go play. So yeah, it gives us a lot of time to connect with them as well at home as a family.
And how has it viewed your shape of viewing her strength and her resilience and motherhood as a whole? I'm sure resilience is, you have to keep playing that back.
It's a perfect term, because I really had a hard time in the first year. You have to have a good support system, and my mom and my husband, he was going through it as well, so she really just supported us and just keep
your mom's great, by the way.
Yes, she's amazing. She's phenomenal. Keeping your trust in God and just knowing that I let Julia lead the way. So we just let her do her thing, and if something's concerning, then we face it. But for the most part, she's strong and doing great, and she teaches me so much. I learned so much through her. Yes.
I bet. Some resilience,
yes.
I'm sure. And what has Julia's diagnosis taught you that no nursing or medical textbook could? You said she teaches you every day. What is something?
I love that I'm sitting with a chiropractor for this, because I use this analogy a lot, but about alignment. So I had to realign my mind. Yeah. When you're in a healthcare profession, nursing, doctors, CNAs, you have this caregiver role that it becomes part of our nature. And I realized that throughout my life, I was caregiving for a lot of people, and sometimes my own needs were put kind of on the back burner. Yeah. Not always in my personal life, but just day to day. And when I had Julia, I had to realign myself with what are our priorities to get through this. Really focus on a new mindset. And it gave me a backbone. And I just love that I'm sitting with a chiropractor for that, because it really did. It made me really have to advocate for myself. So when you have to stand up and advocate for your child, you begin to advocate your own needs, because it's a survival priority. Yes. But you don't stay there forever. And I tell everybody, give yourself grace with achondroplasia for the first year or two, because that is the toughest. All the monitoring and all that, once you get all of that out the way,
testing,
yes, it starts to slow down and you kind of feel human again.
And when those days are very challenging, I'm sure there are dark days when you worry and it weighs on your mind about her future or changes that are coming in the near future. What gives you peace?
What gives me peace is just trusting in God that this is going to work out for us, and having a few key people in my corner that I can call,
especially moms,
other dads, my mom,
right.
people in the community, also adults living with achondroplasia, speaking to them. How did your mom handle this when you were a child? Because I want to hear their lived experience as well.
Yes, so important.
I have some great friends in the community that they're very open about their experiences, and it's such a blessing to me and my journey with Julia as well.
How many people in the Lafayette area in Acadiana have achondroplasia?
I know of about 4 children, maybe 5 that have achondroplasia, and in the surrounding areas, I know upwards of in Louisiana in general, mainly New Orleans and this way. Maybe about 20 adults that I know of in the general area.
And you know them all personally, I'm sure.
I know of them. We meet. I know the children's moms real well and the children in our area, because we connect a lot. But I know. I don't know. I have just so many people that I know now, and I know way more people with achondroplasia than I know people who don't have achondroplasia now.
Oh, no, that's funny. Yeah. You're in the right place.
Yes, in the right place.
I keep saying it, but they're so lucky to have you.
Oh, thank you.
Are there any treatments that are available today? And if there are, can you talk about those or share some thoughts on those?
Yeah, so treatment-wise, historically with achondroplasia was always like a monitoring or a supportive care, bracing for bowing, bracing for spine, high-top shoes, things from a PT standpoint. Yeah. But more recently, there have been some emerging therapies, medication-wise, that can address some of the biological or underlying issues with achondroplasia. So that's really exciting, because a lot of those companies have began to focus and dive deep into some of the research that we have been missing too. So that's really been an interesting thing to search. Yeah.
And so important for sure. And in our local healthcare community in this area in Acadiana, how do you feel like providers support families, or what type of support do they provide clinically but also emotionally?
Yes, so that's the $1 million question. We have some physicians that Julia sees are amazing. They're so willing to learn. So most of them, this is their first patient with achondroplasia, or they've had one or two in the past with achondroplasia. I think her neurologist out of Children's New Orleans has had a handful of patients with achondroplasia. So just their willingness to learn. My pediatrician sat down in an hour-long appointment, Dr. Doug Gonzalez. He's phenomenal.
Where is he located?
He's PALS Group right behind Lafayette General.
Okay, so local.
Yes,
Okay.
local. And he sat down with me and read through all this information with me and just soaked it up. And we collaborate on all her things. And he's just amazing.
He's probably learning from you.
Yes, we learn.
Honestly.
We really. That's what he says. He says he learns as we go, and that's all you can. That's all I ask for is that we're just open to researching everything.
Yes.
And then, from an emotional standpoint, that is the hard part. It's really hard to find emotional support postpartum wise that's covered by insurance if you need that in the immediate postpartum care.
Yeah.
So there's some areas we still have to work on, but to find, that's why I want to do that community connection, because I really find that when I reach out to a mom who's recently diagnosed and I'm like, look, here's photos of Julia, here's what we're doing,
Yes.
this is what it looked like, this is what my delivery looked like, it really can instill a lot of hope. And I know that when I posted on those groups and I was like, this is what they're saying, my inbox was flooded with other parents. This is my child. And it just really got me through, and my husband Edward and I both, and it just makes a big difference.
Yeah, that you have that support system. You can feel that support, even though it may not be right there in the room with you, but
Right.
even elsewhere. So, and so talking about the community and healthcare in the community, what role does the community as a whole play? Not just healthcare, but with healing and supporting a family like yours. Are there support groups specifically in Lafayette, or do you guys have to find other places like New Orleans or Baton Rouge to go to?
Right. We have the couple of moms that we have in Lafayette. We do get together, go to dinner, bring our kids together every
good.
once in a while. But there's Little Cajuns. That's one of the groups, Little
I love
Cajuns.
that.
And what's really good is that the LPA their conference is in New Orleans this year. So that'll be an amazing event.
The nationwide
The
conference?
nationwide conference will be in New Orleans. So we're going to have our
wonderful.
Little Cajuns all at in New Orleans.
Okay.
Most of them are hubbed around there anyway. So, yeah, we try as best we can to support each other. And that's...
Well, it sounds like y'all are doing a great job,
Yes.
so that's wonderful. And you did talk about your collaboration with new parents, but to be very real about it, what is the conversation that you have when you first speak to a new parent who knows that this is the diagnosis that they've just received, just beginning that journey?
So I tell them to take a deep breath, that I'm going to send them over a slew of resources and information, and to read everything. Read it and know the condition for yourself as best you can, because you're in shock. So just read the highlights. I have a highlighted, we call it Nurse Fix Quick Tips, and I send them like what to know in the immediate postpartum, what to know for my MRI, what to know for my first ENT visit. So we have these Nurse Fix Quick Tips flyers that we...
That is wonderful.
We try to summarize the medical jargon into easy to read format for parents. So yeah, just learn the information as best you can. Be prepared to advocate for your child. And we're always in your back corner. They can
Right.
call me. I even give them my number. Like, call me anytime in your appointment if something doesn't feel right.
That is so wonderful. I hate to say I'm proud of you,
Oh,
because I shouldn't
thank
say it, but
you.
I'm so proud because I've known
Yes.
your family over the years now. So it's wonderful to see and watch what you're doing. So
Thank you.
And what does inclusion look like
Yes.
for you and Julia and as a family in either, I know she's only 3, but either at daycare, schools, the playground, everyday life?
Yes. So what I really didn't even realize till I had a child with achondroplasia is that just going into a bathroom in a public place that doesn't have a stool, just trying to open a door that is too high, that's a heavy latch that
We don't think about these
you don't
things.
know. So the inclusion aspect of this is so important and something that needs to be highlighted. Just having the stools in the bathrooms that flip down where you can wash your hands, that's amazing for our family. Just having that to where I'm not trying to hold Julia. I've been to counters where I'm trying to pay a bill and the counter's this high on me. And I'm like, you wouldn't even see a person with achondroplasia behind that counter. Backing up cars, you don't think about that, but sometimes they're below where you could see when you're backing up. So sometimes I hear they receive pushback for getting a handicap parking spot, and it's really important for people with achondroplasia.
And there was pushback?
Yes, in parking lots. So just things like that. I think our communities are trying to bring that awareness forward about the needs of that community.
Yes. Okay.
Yes.
Now you're getting me excited about it. What are your hopes? I know for any mother of any child, we have hopes, we have dreams for our little ones. But for you, and knowing the challenges that she'll face, or that she is facing, what are your dreams for her?
My dreams and my hope is that Julia in the future can advocate for herself, that she feels comfortable in her own skin, that she can, discuss some of these misconceptions in a matter-of-fact way without feeling really defined by sometimes what the world says and it's not the truth. That she goes on to lead a successful, happy life, that she's happy. That's my biggest hope.
Sure.
That she's pain-free. That's my goal, because there's a lot of pain sometimes associated with some of the spinal things with achondroplasia. And one of the things I didn't touch base on, though, is that the M word, which if you don't know what the M word is, you can Google it. I'll never say it. It's a very derogatory term, and I don't think a lot of people are aware that term is derogatory. So I just use opportunities like this to spread that kind of awareness.
Yes.
So yeah, things like that. I just don't want her to be defined by terms. I want her to be known as Julia. And that's, people that live with achondroplasia or dwarfism, they want to be addressed by their name. That's Julia, and she happens to live with achondroplasia. So that's...
Well, I think there's no doubt that she will certainly have that type of future with a mom like you.
Oh, thank you.
So, if Julia listens to this episode one day, what do you hope that she will either learn or take away about your story, or about her story, or herself?
That she can do anything. Whatever you want to do, no matter how hard life gets, no matter how scary it is, you can do anything. You can, and really it all works out for us. So just to trust in God and do what you want to do, and you will be successful.
Yes, face those challenges.
Yes.
So my last question is usually, how do you maintain your posture while pursuing your purpose in life?
I think that goes back to just really being aligned with my frame of mind of stand up for yourself and advocate for yourself and process things, take the time and have those boundaries to tell people I need to process this, because I was met with a lot of judgment sometimes about how I was processing Julia's diagnosis, especially because postpartum crisis is not well understood. So just put those boundaries if you have to, and process everything you need to process, but try not to stay there. Know that it gets easier with time, and just have your people in your corner. Those people in your corner they'll drag you up if you need to be.
Thank goodness
yes,
for those
good
people.
to lean on.
Oh my.
And before, I forgot to mention this, but there's two really important things I want to touch about for life-threatening signs for achondroplasia. So one of them would be, I don't know if they can see this on camera, but this is a photo of Julia blowing bubbles. Okay, that is called foaming in a flex position. So with achondroplasia, they have a large occiput. So when you put them in the car seat study, they need a car seat study right away at birth. But when you put them in the car seat, their occiput wants to push their head forward, and then they have low muscle tone, so they can't maintain an airway. So they do a stertorous breath sound, which kind of sounds like, and it froths up their secretions, and it can lead to cardiac arrest. So when you see a baby foaming and they're in a flex position, so laying on their back, any of those things that push the occiput forward is considered a medical emergency. And unfortunately, one of the misconceptions with that is to put a neck roll. A lot of pediatricians or the hospitals say put a neck roll. But really with achondroplasia, you need a shoulder blade roll so that it gives room for the occiput to fall back. Because if you put a neck roll, it's just going to push the occiput further forward. And this is just a little wrist rest I got off of Amazon for the computer, but we did the car seat study with it behind her shoulder blades, and it works better than a rolled up towel because it holds its shape, it's firm, but it has the beads that but you have to get this approved by your physician, and it has to be tested in a car seat study. So that's one of the most important things. If you see foaming in a flex position, please let your pediatrician know. There's an amazing article. They can reach out to our website, www.chartlongbones.com. And I have that article pinned. And then the second one would be that because they're low muscle tone, feeding complications are common in the achondroplasia infant. They have a bell-shaped abdomen, meaning their chest is small, the belly's bigger. That does a back pressure on the abdomen. So when you're feeding them, They can't take as many ounces, so they take less ounces sometimes more frequently. And sometimes that can be flagged as a failure to thrive, even though they're not failure to thrive. It's not a traditional failure to thrive, because achondroplasia babies' weight will be they're 2/3 of what an average height baby's weight will be at a year old. So there's a weight gain velocity in infants with achondroplasia article that if a physician feels the baby's not gaining weight appropriately, they can do a calculation on grams per day that an achondroplasia baby should be gaining. So that's one of the misconceptions. A lot of them will get NG tubes unnecessarily because they assume the baby's not feeding well or not gaining weight appropriately, but they actually are for achondroplasia. So 2 great articles that can be found on our website to prevent some of those care.
I mean, so much wonderful information and necessary information. You mentioned your website, but if there's someone listening or a family member of someone that needs this information, how can they find you? Would your website be the best form of communication there?
Yes, they can go to www.chartlongbones.com, and it has an area where they can message me. So anything they have questions about, our resources are on there. They can also find me all over social media. If you just join any of the dwarfism pages, achondroplasia pages, and you just search Victoria Garcia, it'll pull me up in all my discussions in there. I'm also on the Picnic Health website, which is a research-based platform for achondroplasia, and they have some articles with me in there as well about care for achons. So
I think we're going to be hearing a lot about you
thanks
and your group and your advocacy support for years to come. So
thank you.
Thank you for everything you're doing for this community and for your research, your time, and the heart that you're putting into this.
Thank you.
And thank you for being here today.
Oh, this is wonderful. I could talk about achondroplasia forever.
And that's great.
Great, yeah.
That's great. So until next time, sit up straight, stay happy, stay healthy, and stay adjusted.
Thanks for listening to the Posture and Purpose podcast with Dr. Michelle Carr-Frank. Make sure to subscribe on YouTube, Spotify, and Apple Podcasts. Until next time.